So what's another alternative to our established treatment models of medication or talking therapies? Well, you may have heard of stratification or personalized medicine. Essentially, stratification explores factors like age, gender, and genetics, and how these affect how people experience mental illness and respond to treatments. So it takes a more personalized approach and a people-centered approach. And it stresses that individual differences, so differences between individuals regarding age, gender, genetics, etc., matter in terms of the treatments for anxiety and depression. And it can help researchers focus on finding the right treatments and at the right time. It's necessary to improve the efficacy of individual treatments, some researchers would argue, because it aims to identify subgroups of individuals within a heterogeneous disease population. So that would be something like anxiety. What stratified medicine or stratification tries to do is identify subgroups. So it might be young females, or it could be middle-aged males, or it might be females with both depression and anxiety. Those could all be subgroups. And it could take those subgroups and look at the characteristics of those subgroups in order to then understand what are the underlying mechanisms, risk factors that might be affecting this subgroup versus other subgroups, and therefore provide a more personalized and effective course of treatment and response. So a bit more on stratification here. So I'm not going to read this whole report, but I have linked it below and I would recommend you read it. But essentially, stratification is also known as precision psychiatry or personalized medicine. So it is a way of making sure an individual, although they might just have, they might be labeled with anxiety, they actually might have a very specific type of anxiety. So as you can see in the diagram here, there might be biotype 1, biotype 2, 3, 4, 5, 6, 7, 8. And these could be based on a combination of symptoms, physiology, life experiences, lab, genetics, and cognition. And from these biotypes, a clinician would be able to work out what is the best treatment option available for this person within this clinical subtype or biotype. And this is much better because it means that treatment options are more likely to be effective if they are suitable for that specific biotype. Again, what might be some of the pros and cons of stratified medicine?